Afternoon and welcome to our webinar, The Architecture of Health Disparities, Housing and Energy. Before we begin, we at the Medical Society Consortium on Climate and Health respectfully acknowledge that our work takes place on the occupied and unceded lands of Native American tribes. We honor the enduring connection of Indigenous peoples to these lands and waters. We also recognize the enslaved people of African descent, Indigenous laborers, Chinese railroad workers, Japanese Americans incarcerated during World War II, and countless immigrant and American-born workers whose labor has shaped and continues to sustain this nation. Today's webinar is the fifth in our 2026 Climate and Health Equity webinar series as part of the Climate and Health Equity Fellowship Program. The CHEF program recognizes the need for more climate and health leadership and a sharper focus on equitable climate solutions. The goal of this fellowship is to educate physicians from populations that face greater burdens from climate effects and are underrepresented in medicine to become leaders in climate and health equity education, advocacy, and policy solutions. I'm Dr. Shanita Johnson, Director of the Climate and Health Equity Fellowship. Also joining me from the consortium to run this webinar are Dr. Venice Curry, Associate Director of the Climate and Health Equity Fellowship, Dr. Kimberly Williams, the Director of Operations and Strategy at the Medical Society Consortium, and Clarissa Payton, Chef Program Assistant. Clarissa will be available through the chat to answer any technical questions during this webinar. This webinar is hosted by the Medical Society Consortium on Climate and Health and is held for 1 hour on the second Friday of each month from 3 to 4 p.m. Eastern Time. Today's webinar will be recorded and made available on our YouTube channel and website for future viewing as part of the Climate and Health Equity webinar series page on our website. We know that housing and energy inequities are deeply embedded drivers of health disparities, shaping exposure to environmental hazards, household financial stress, chronic disease risk, and overall well-being. Today, we are honored to have a luminary in this work speak for this webinar. Our speaker is Dr. Mustafa Santiago Ali. Mustafa is the Executive Vice President of the National Wildlife Federation and the founder of Revitalization Strategies, whose focus is on moving our most vulnerable communities from surviving to thriving. He has over 30 years of experience at the intersection of policy, community engagement, and sustainability. He previously served as the Interim Chief of Programs at the Union of Concerned Scientists and as the Senior Vice President at the Hip Hop Caucus. His career began at the Environmental Protection Agency, where he was a founding member of the Office of Environmental Justice and later served as the Senior Advisor for Environmental Justice and Community Revitalization and the Assistant Associate Administrator for the Office of Enforcement and Compliance Assurance. He will highlight community-driven solutions, advocacy strategies, and equitable approaches that can reduce energy burden, improve health outcomes, and advance environmental and climate justice. But rather than using our time to provide a further description of his impressive work, we are placing a link to his bio in the chat. The general format for today will be a 40-minute presentation by Dr. Ali, followed by questions and answers from the audience. We ask that you put any comments, links to resources you recommend, or any questions that you may have for our speaker in the chat box at any time, and we will get to as many of the questions as we can during our Q&A period. Please do keep yourself muted so we are not interrupted by background noise, and please begin, Dr. Ali. Thank you.
Well, thank you for allowing me to share a few minutes of my time and of our time together. Let me just also thank Dr. Mark Mitchell, who began this important journey of making sure that all of us really understood the health impacts and the sets of opportunities that are in front of us. I want to also thank all the leadership who pulled this together. I was just sharing a little while ago just how incredible the information is that's being shared, but also bringing forward all of these amazing faces that America often doesn't see and honor in the way that it should. I've been incredibly blessed. I've worked in over 1,000 communities now. across our country and some outside. And there are many of the similar dynamics that folks are facing, whether in rural or urban communities. And even when we go outside of our country, some of these very similar dynamics are going on. We have an opportunity to address those and to be able to make sure that everyone has the opportunity to live in a healthy and sustainable community. So with that being said, I want to dive in because I'm looking forward to our conversation after I finish. So if we could just hit the next slide. So I always like sharing this particular quote because I think it says a lot about how we can show up. And Gandhi once said that Earth provides enough to satisfy every man or woman's needs, but not enough for every man or woman's greed. And when we see injustices, when we see disproportionate impacts happening, it is often because folks are not in harmony and not honoring both our humanity but also our walk with Mother Nature. Next slide. I wanted to bring Audre Lorde into our conversation. I guess you could drop something in the chat if you know Audre Lorde and have had the opportunity to read her work. She was just an amazing writer, activist. One of the first to also talk about intersectionality, which is so incredibly important in relationship to our conversation today. Because when we look at both impacts and opportunities, they come in many forms and fashions inside of a community with many different sets of needs that are there. So it's not a single issue. No one lives a single issue life. At least I have not met them yet. So intersectionality will be a big part of our conversation today as we navigate how do we address some of these challenges that are in front of us. Next slide. And I thought that we're going to have an authentic, truthful conversation. You know, when we're thinking about politics, when we're thinking about policy, when we're thinking about housing or transportation or health or a number of other critical issues for all communities, but especially our most vulnerable communities, we have to look to some of the choices that have been made in the past in relationship to policy. We know the impacts that have happened to our Indigenous brothers and sisters. The Trail of Tears is just one example, but displacement has always been a part of a framework that has never been healthy and has never been helpful. So we also have seen in relationship to African Americans being brought to this country. And when we think about whether it's Indigenous brothers and sisters or Black folks, when you look at where people are placed, disinvesting in those locations, often in housing that is most definitely substandard, then we see many of the health impacts that are also tied to that, and we'll unpack that as we move forward. Next slide. I also wanted to bring into our conversation, our Chinese brothers and sisters, our Japanese brothers and sisters. If you have been a student of history, you've also seen the impacts that were happening to many of the Asian communities inside of our country. If you ever took a look at the Japanese internment camps, how people were removed from their homes, removed from many of the things that they had invested in and then placed in these camps, then you have an understanding of how we've gotten to some of the places that we have in relationship to housing insecurity, housing justice, and why we need to make sure that we are addressing it, along with a number of other issues. Next slide. And some of the laws that were in place, a lot of folks don't even know that they ever existed, but they continue to echo through investments, continue to echo through the injustices that many people face. Of course, redlining and restrictive covenances have played and continue to play a devastating role in many of the impacts that folks are dealing with. If you look there underneath the restrictions, the language is very, very clear. It said that no person or persons other than the Caucasian race shall be permitted to occupy the above described property. And those were laws that were literally on the books. It was a part of the segregation plan. It also pushed people into areas that were the least desirable. It impacted who could move where, and a number of other dynamics that we will unpack as we move forward. Next slide. I often say that housing justice is health justice and climate justice is housing justice because literally you can look at someone's zip code and have an understanding of many of the health challenges that they may be dealing with. You can also look at many zip codes and have an idea of how long someone may live based upon where they are currently living. Next slide. These are some of the policies that I wanted to bring forward that you might not be familiar with in the housing context. In 1934 was the National Housing Act, and I highlighted a couple of points for each of these that might be of interest to you. So under that National Housing Act, you had redlining and mortgage discrimination, and then you had the poor housing and disinvestment. And that began also sort of reinforcing the wealth gap that exists inside of our country. And of course, wealth is tied to many things. If you have it, in many instances, you can afford better health care, you can afford better food, you can be in places where you don't have many of the toxic burdens that are going on, so forth and so on. So we can trace back to the earliest days of some of the things that were placed in law and legislation that have had devastating effects on communities. In 1949, you also had the Housing Act, and that's when really urban renewal began to displace people and to move them into different locations. And a lot of people lost homes and they lost community. And we all know community is so incredibly important in the health component in relationship to both physical and mental health. And then 1956, the Highway Act, when we look at where many of the disproportionate impacts come from, transportation has played a critical role there. And we also know that many communities, especially communities of color, were often broken up through roads and highways, and then had the extra sets of pollution because at that time, lead was still in gasoline and a number of other types of things were going on. So certain communities got those impacts where others didn't. And then 1930s is also a part of the redlining. Next slide. These are just a couple. I mean, all of you are very well versed, but I thought that would just bring forward, and then we're going to talk more about it as we go through. Some of the housing inequities that have had impacts and continue to have impacts, of course, is asthma, lead poisoning, heart disease, mental health stress, which we don't talk enough about, heat illnesses, shorter life expectancies. And one of the things I thought the docs would take away from this is that your patient's address is often a predictor of health. Next slide. I thought not just talking in the historical context, but actually bringing it forward to some of the challenges that folks are dealing with right now. So if you look at Birmingham, Alabama, which is on the left hand of your screen, you can see the rail system that's there. So people are getting the diesel emissions that are there, along with many of the products that are being utilized on the railroad lines. And then you also have Superfund sites that this community is dealing with. Their housing is built very, very close to that. So, of course, Superfund is some of our most toxic sites. So folks are trying to navigate that, and they get that exposure 24 hours a day. And then, of course, many people have heard of Cancer Alley, communities running between New Orleans and Baton Rouge. I've spent lots of time there. Many of those homes have been there way before those petrochemical companies became in, but now they have some of the highest cancer rates in the country. And once again, this is 24 hours a day, 7 days a week, 365 days a year that people inside their homes are breathing in toxic pollution, along with dealing with older housing and many of the challenges that exist inside of that space. Next slide. I thought I would also bring in the Manchester community in Houston, Texas. So you get a chance to see it from a couple of different angles there. When you go to the Manchester community and when you go on people's back porches, you can literally reach out your arms and touch the fencing of these petrochemical companies. And they have to deal with these situations continually. Now with the changes that are happening because of the climate crisis, they deal with flooding, they deal with the hurricanes, they deal with the pollution being moved around. And just like Cancer Alley, almost as far as the eye can see, there's the footprint of these facilities, and folks are there in their housing, often feeling trapped and looking for help. Next slide. Also in the housing context, you have folks who are dealing with unsafe water, unsafe sanitation. Lowndes County, Alabama is an example. If you look right there outside of that particular home, you have untreated sewage that people have to walk through. Catherine Coleman Flowers actually wrote a really amazing book on what's going on in many parts of the South in relationship to this unsafe situation and many of the diseases and pests that are also tied to these types of injustices that are going on. If you look on the right-hand side, that's Atlanta, Georgia. Often people think about the flash of Atlanta, but many of the folks have had to deal with their basements flooding with untreated raw sewage and many of the impacts that are going on in that context that we will unpack. Next slide. And I wanted to bring into our conversation also, so we've got these, for those of you who may not be familiar, CAFOs, Certified Animal Feeding Operations, that often have thousands and thousands of livestock. Sometimes it's hogs in North Carolina, can be chickens, can be turkeys, but many of the homes that have traditionally been in these areas are now being overwhelmed. They're being overwhelmed by the smells, they're being overwhelmed by the pests, they're being overwhelmed with the water quality. I talked to folks before who used to put their clothes out on the line, before these facilities became what they are. And now fecal matter and everything else is on their clothes and gets into their houses. And as many folks know, temperatures continue to go up. So people can't just shut their windows. People can't just turn on the air conditioning because everybody doesn't have that. So they're dealing with these situations where their housing is literally being surrounded in many instances by livestock, by what's going on with these lagoons from the waste from the animals. So when we think about housing opportunities and injustices, we can't have that conversation without also talking about these impacts that are happening from CAFOs. Next slide. And then, of course, lead. This is Chicago. Many of the houses there have been dealing with significant impacts from lead. We all know the impacts, that happen to children and babies. So Flint, of course, was one example. Some of the things going on in Mississippi have also garnered attention in Newark. So in many instances, people are living in housing that has sometimes still lead paint, not as much as it used to be, but definitely in the pipes and the impacts that are going on. Next slide. And this is an image that I really like because it answers many, many questions about why housing justice is important. What is housing justice? How do we move forward on housing justice, especially in a warming climate, at a time when resources continue to shrink, but the need continues to be significant. Next slide. Margaret Mead once said, because lots of times you will meet folks and they're like, well, my voice doesn't matter, or I can't make change happen. And this is just one of those quotes that I always carry with me to remind me that it does not always take a million person movement in the beginning to begin to, march to a change. So she said that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So whether we're looking at the civil rights movement or the women's rights movement or the early environmental movement, it has always started by a small group of committed folks sharing the message, sharing the need, and sharing what the future can look like. And then the work begins. And that doesn't mean that it is a year or 5 years or 10 years. It truly is a journey. It is a marathon, but it begins with us. Next slide. And of course, For those of you who know me, who have ever heard me, I always make sure, one, that I honor my mother and my grandmother, who are the rocks that I stand on. But also, all these amazing, incredible leaders who sometimes don't get the same attention as others. So I always want to make sure that there's a strong matriarchal movement. There are men, of course, who are a part of it, but I always want to make sure that I'm giving the sisters their props because in many instances, all of our movements, they're the ones that hold the movement together. In many instances, they're the ones who started the movements. And I just want to make sure that I always recognize that. Next slide. James Baldwin said that if I love you, I have to make you conscious of the things you don't see. Often we don't see the injustices that are happening in relation to housing equity or transportation equity or environmental justice or health justice. And there are many reasons why we don't see that, but that is one of the dynamics that we have the ability to change. And we've just got to make sure that we continue to put a spotlight on it. And that's why anytime you all call me to be a part of this series, I think it's so incredibly important that we bring forward not only the practitioners who are working on these issues, but also putting a spotlight on the sets of needs that are happening in communities. Next slide. And I just want to make sure that, as we move forward, and we're going to be talking about some of these additional burdens that communities are now facing, that we also anchor it in scientific research and how large the need actually is. Harvard, I think it's now 4 years ago, put out a study, where they talked about over 350,000 people are dying prematurely from the burning of fossil fuels. So anytime we start talking about bringing new technologies in that are going to utilize fossil fuels or not beginning to minimize and shrink our usage, then we are continuing to put people's lives in the crosshairs. Let me just put this in context for folks. We've got more people who are dying from air pollution than are dying from car crashes, who are dying from gun violence, who are dying from overdoses of drugs, even though that is, of course, we've got so much work to do there and it begins to tick up. I want to also just share real quickly before we go to the next slide. When we're talking about these types of numbers, 350,000 people, think of your favorite football stadium or basketball arena. Many of those hold between maybe 60 and 100,000 maybe for the largest ones. We're talking about 3 times plus that. So next time you go to a sporting event or a venue that holds lots of people, just real quickly imagine that moment when you're there with everybody and then in the blink of an eye, they're gone. Because I think we have to put this in perspective for people about how significant this is and why we need to be laser focused on addressing these issues around energy efficiency, around addressing the climate crisis, on housing injustice, so forth and so on. Next slide. The other reason also is that many of you probably know someone with asthma. When we asked the question, 30, 40 years ago, there was many fewer folks. But now we know that the numbers are around 24, 25 million folks in our country who are dealing with asthma. We know that the impacts for the African American community, continue to be more significantly impacted than others. But, in a moment when folks are trying to make a decision between putting food on the table, being able to pay the rent, or being able to purchase the medicine that is so necessary, whether it's for themselves or for their children to be able to survive, we've got to be able to address these issues. And that's why the work that you and others are doing is so incredibly important. And that's why we've also got to understand in totality the significance of what's going on when we're talking about these various types of inequities and pollution that people are dealing with. Next slide. And of course, there's 7 million kids in our country, and mostly, primarily it is Black and Latine communities who are going to the emergency rooms and who are losing their lives. But I come from a rural community. In many instances, those numbers are not being captured of folks who are also unfortunately dealing with these very challenging situations in relationship to housing. Next slide. I always bring Dr. King in because it helps us to reinforce the fact that, he says that our lives begin to end the day we become silent about things that matter. Many of us are blessed to have the ability to have some small or maybe medium size, or for some folks it may be larger, ability to connect with folks, to be able to use our platforms to help people to become educated. Now, and if we're silent about what's going on, then we're missing an opportunity to actually be able to, not only just make this a better world, but to make sure that no one has to deal with these sets of challenges. Next slide. I also wanted to bring in, these impacts that are happening on the air pollution side to babies. There's new research that's out there talking about the impacts not only to their lungs, but also to their brains. Black carbon is becoming a better understood issue, and the impacts that are going on the liver side of the equation, and a couple of other areas. So I always want to bring that in because the conversation is important to talk about asthma. It's important to talk about a couple of the other areas that we often highlight. But as the research continues to grow and we're having a deeper understanding of how impactful some of these toxic pollutants are, then we need to just make sure that we're well versed when you're sitting down having a conversation with a patient or someone who you're garnering information from. Next slide. And this is another slide that I often bring in, talking about before babies are even here, some of the challenges that are going on. Climate's making it more challenging for ladies who are pregnant and are having babies along with the toxic pollution. And now that the heat, we just recently saw, I think almost 2/3 of the country setting records in relation to extreme heat. And the climate crisis is going to continue to tick those numbers up. So more folks will be going to emergency rooms. More folks, may have fetal distress. So we just got to make sure that we're understanding the totality of what's going on. Next slide. And I always bring in, because I grew up in a couple of places. One, of course, most folks know I grew up in Appalachia, but I also lived in Detroit. And in Detroit, they have some of the dirtiest air, the 48217. It's one of the dirtiest zip codes. And kids who are living in the houses there often look out their windows. They don't see green space. What they see is the flaring that's going on with plants. So once again, where you live, the house that you grow up in can have significant impacts. It has impacts on how you learn. It has impacts on your health, and of course, your future. Next slide. And I just want to bring it to our conversation. Many folks, and myself included, like to get out, like to hike, like to go to national parks and other types of parks. And now we're actually seeing increases in pollution and increases of impacts from the climate crisis that are also happening now in those places that we go to be able to reconnect with nature, to be able to hopefully begin to heal some of the mental stressors that we have going on. Some folks reconnect with their creator. But now there's some challenges in that space as well, and both on the air pollution side and the climate crisis side. Next slide. And this is the Manchester community. I just wanted to bring this in because I wanted folks to also understand. So there are sets of houses to the left and the right of the school, but you can see there in the background the flaring that's happening there. Everybody who's here, who's watching this today, has been blessed to be able to go to school, and then they go to college and grad school, medical school. I always ask folks to just imagine growing up in the Manchester community, and then being able to navigate all the things that are necessary to be able to move forward through education. And this is what these kids have to do. And then also, being outside with sports and breathing in this toxic pollution on a regular basis is just one of those dynamics that we have to work diligently on to be able to address. Next slide. These are some of the health impacts, and some of you, will definitely be able to have and understanding some of the things that folks are breathing in, whether it's benzenes or formaldehyde or mercuries, and a number of others. I won't go through all of them. You all know them. But that's some of the impacts that folks are dealing with there. Remember, I said when you stand in many of these people's yards on their back porches and you reach out, you can touch the fencing for where these plants are. That's how close that folks are dealing with from their own homes with what's going on around them. Next slide. And then, of course, this year is the diesel death zone that's in California, over in Wilmington. We just got done, and we're not done yet with the World Cup. But I always think about folks who are out there playing soccer or football and what they're breathing in and how close the housing is to these situations. And that goes back to the James Baldwin quote, where most people would never assume that there are folks who have to deal with and navigate these very deadly sets of situations. Next slide. And then Flint and Jackson. And for those of you, I've worked in both of those areas. The amount of challenges, holding children in your arms, who are going to have to, navigate some of these neurological damages from lead and some of the other things actually that was in the water, and the homes that they've lived in. It just brings everything full forward of these lives these precious young lives deserve to be fully protected and should never have to deal with these types of situations moving forward, not in the United States of America, which is one of the wealthiest countries on the planet. Next slide. This is Catherine Coleman Flower's book, Waste, and it goes in relationship to some of those earlier images that you saw in Atlanta and in Lowndes County, Alabama, of some of the things that folks have to deal with inside of their homes. And as soon as they step out into their backyards or front yards, in some instances, with these overflows that are going on and exposure to untreated, unfortunately, sanitation and wastewater. Next slide. And I just brought this in because I wanted to just make sure that folks understand as I move to the next part of our conversation that we've got 2.6 million miles of fossil fuel pipeline. To go to the moon is about 235,000 miles. So I want you, when I think about how much fossil fuel pipeline we have in our country, and how the distance to the moon and back, and how we have so much more pipeline than it would even take to go to the moon once. Actually, you can go a number of times. That we have to get our arms around moving toward cleaner forms of energy so that these health impacts will not continue to grow. Next slide. And of course, we've got the mining that's going on and the questions that are in that space and the impacts that are there as well as we begin, for many, a mad dash to building data centers and to being able to grow this AI infrastructure that's out there. Folks are going to continue to receive many, many impacts on the mining side, even though some of the precious metals and critical minerals, of course, come from other locations, but we should be just as mindful if it's coming from the Congo as we are if it is coming from South Dakota or North Dakota. Next slide. Now, I wanted to just dive into some of the AI data centers since, we were just talking about, some of the mining that's going on to provide what's necessary and just make sure that we at least have a baseline of understanding when you are talking with patients or just so that you have the information that's necessary to, have a cogent conversation about data centers and public health. So, they create significant localized public health risks. You'll hear many things in the press that tries to minimize that. And that does not mean that we cannot continue to grow and to get to a place maybe in the future where there are less impacts, but right now there are significant impacts that are happening from air pollution, water pollution, noise pollution, electrical grid strain, and of course, vulnerable communities and overburdened communities already are dealing with many of the things that you saw before. And now there's another layering or an additional cumulative impact that folks are going to be dealing with. And there'll be some other things that I'm going to unpack around AI stuff. Next slide. So let's start with the air pollution, right? Um, so many of the data centers, of course, are burning fossil fuels. It's a part of their generators to create their electricity. So you have the particulate matter that's going on, you have NOx, nitrogen oxides, and other things that are a part of that. And of course, you all have the understanding that it's tied to asthma, strokes, premature deaths, heart disease, and a couple of other health impacts that are in that space. Now, this particular slide also talks about sort of some of the projections around how many additional lives that will be lost prematurely as we begin to build out. But I want to put this in context also because when this slide was first put together, we didn't have as many data centers as we currently have that are, up and running or are close to beginning that process. So I think the last number I saw was we currently have between 4,000 and 4,500 data centers in our country. And of course, it's projected to just grow exponentially over the next 5 years. Next slide. Now, there's also the noise pollution that often doesn't get as much attention. And some of these larger data center sites, you've got, I think the number right now is about 85 decibels. Sometimes it's slightly more. You've got to remember that these things are running 24 hours a day, 7 days a week, and many people's homes are located very close by. So we're now seeing from folks, some things around hearing loss. The chronic stress one is the one that really gets my attention because, that can contribute to a number of other sets of challenges that folks have to deal with. And of course, if you don't get enough sleep, it's hard for your body to recover. So we really got to also figure out what, if a data center is going to exist, how to minimize that. Next slide, because there's some more things we need to talk about in relationship to this. Lots of times people talking about water scarcity, and that is most definitely a challenge. 3 to 7 million gallons per day for some of the larger facilities that are out there. We know that many locations across our country right now are dealing with water insecurity, and because of the droughts, because the winters are not producing as much snow, so the snow caps and then the melting is not happening as it once did. So we got to think about that. In some areas, people's water bills are going up. And so it's creating some challenges that are there. As you can see in one of the bullets there about the aquifer depletions that are going on in certain locations. So there's only so much fresh water that's out there that we know about. So we really need to take these things into consideration because of the public health risks and the other risks that are also there. One of the areas that is not talked much about, and the science is still developing on this, is around EMFs, electrical harmonics, and understanding that when you're living close, and many of these houses are pretty close, when you have these disruptions that are going on the electrical load side of the equation, they label it as dirty electricity. That's the language and the framing that folks are using right now. There's these waves that go out, and there's still research that's going on there to really have a better understanding about what the public health impacts are. But many of the folks who've been doing this research have raised, some concerns about it. I do not have expertise on the EMF side. I remember for a number of years in relationship to a grid and to some of the emissions that were coming from some of the power lines and some of the other things, that there were some concerns about the possibility playing a role with cancer. That research and this research, still needs to continue for folks to have a better understanding, but it is something that is now being talked about. Next slide. And I just wanted to bring forward a couple of real life case studies that are currently going on. Many of you have probably heard about what's going on in Memphis, Tennessee. Of course, you also have to understand that the folks there in Memphis have been dealing with a number of challenges on the air pollution and water pollution and solid waste side of the equation. So now you've got the Colossus supercomputer that's been put there. They are burning fossil fuels. So there's going to be, additional impacts on the air pollution side. There will be additional impacts on the climate side of the equation. And the community concerns are what you see there. It's increased air pollution. They already have very high levels of asthma in the community. And they're just worried about the toxic loading that's currently going on. On the other side of the equation, for the case study, is the data center out. So that's what they're calling Loudoun County in Virginia, probably about 30 miles outside of DC. So just like we have Cancer Alley that's currently going on in Louisiana, they're now calling this Data Center Alley. So hopefully you all will pay attention to some of the things that are going on there. Right now, I think they have more data centers in this particular area than anywhere else across the planet right now. And these are some of the things that residents have reported. They've said that they're dealing with chronic noise, they're dealing with sleep disruptions, they're dealing with headaches, and they're saying reduced quality of life. We'll see what some of the other impacts that will be reported from communities will be, as time is moving forward, since the rush to build in this area has been so fast that the health data has to catch up with what's currently going on. Next slide. I wanted to just also bring forward in relationship to data centers, some of the solutions and resources that are out there. I've been saying that if data centers and if communities want to have a data center, and that we need to green those data centers, and that means using renewable energy. In certain locations, that might be wind, it might be solar, it might be tidal, it might be thermal, which a lot of people are looking at. Just for full transparency, there's also a conversation that's going on around nuclear, small scale nuclear. So all those things are currently out there. And we just got to move away from both these fossil fuels that are used around the generation of the power. Got to have better battery storage so that folks don't feel like they may have to switch back to the fossil fuels if the renewables are not fully meeting what the particular need is. And then again, the closed loop will help in relationship to the water usage, but that is not, a total solution for some of the challenges that are going on. I also wanted to just bring forward a couple of places that you could get more information if you want to go deeper. There are a few pretty reputable places out there. You can always email me and I can get you some information, additional information. But the Environmental Health Project, and then of course over at Harvard, the Public Health School is doing a lot of research on what's going on in relationship to data centers. Next slide. And then I think culture is so incredibly important. We've got these climate crises that are going on. We've got energy crises that are going on that are tied to the impacts that are happening from the climate emergencies. And I always like to call out people who are doing things to actually help. Beyonce is one of the folks. There are a number of artists and entertainers out there who are starting to get more engaged in relationship to a number of the issues that we talk about, whether it is the climate impacts that are going on, environmental justice, housing justice issues, and economic justice issues, of course, as well. So when folks are trying to do the right thing, we should be partnering with them to make sure that they have the scientific information, and then they can translate it into whatever the gift is that they may have, whether they are singing or rapping or a poet or a painter, whatever it might be. I think culture is incredibly important as well. And the other part of it is that they are influencers, but so are doctors. Doctors are influencers. They are trusted by many, many folks. So we need as many types of influence that is rooted in fact and rooted in community to be able to spread positive but truthful messaging on what we're facing and the opportunities in front of us. Next slide. And these are just some of the other impacts that are currently going on. And since we were talking about housing earlier, it's just devastating with these hurricanes and floods and a number of, various things that are happening because of the climate emergencies that we're facing. But in many instances, our housing is our greatest amount of wealth for many folks, not everyone. So we've just got to be mindful of what's happening in this space. Next slide. And of course, this is some of the impacts that are happening on the East Coast, because often we think about Florida or Texas, or Louisiana, Mississippi. Now we're dealing with challenges. People are literally losing their homes. I remember in New York, people who were in bottom level apartments and homes who were flooded. And then all the impacts with mold, the impacts with asbestos, the impacts, the number of other things that were inside people's houses and domiciles that we just have to take that into this set of work and begin a holistic strategy to address it. And of course, docs, you have to deal with what happens after these events. And whether people are in the emergency rooms or in other rooms, they're looking to you as well for guidance on what's going to happen to their bodies, as well as what they can be doing to help to strengthen them. Next slide. And I had to bring this into our conversation. You can't see the housing, but for farm workers, I began my career a long time ago. And one of the first places that I went was actually out with farm workers. And that time was pesticide exposures and seeing folks who often 20 people inside of a small place living and dealing with all of the sets of exposures. And then, of course, now with the fires that are going on, these wildfires that are happening, in many instances, people are afraid to leave where they are because of lots of different dynamics that we don't have to jump into today. But of course, they are also dealing with all the air pollution that's going on and a number of other things. Next slide. There's some other solutions. There's tools that are out there now, both on the federal and the state level. Of course, we understand on the federal level, things pop on and then pop back off. But GIS tools that are out there can help you to have a better understanding of somebody you're working with. If they share their address, you can get a better understanding of the things that are around them, things that may be impacting them, so that you can have a better understanding of what their particular sets of needs might be. But one of the things that's just critically important is that we make sure that we continue to protect the data and information that is so needed to make sure that people have it at their fingertips. Next slide. Also, part of the solution is there are still an amazing, number of young entrepreneurs who continue to be out there and continue to help us to have better transportation opportunities that are less impactful, helping to find ways to be able to cool or heat our homes, along with our churches, our synagogues, our mosques. So, a number of folks are moving forward on that. Now, of course, if we were having this conversation 3 years ago, there was a number of different pieces of legislation and actions that had been passed in the last administration and resources that are not currently there. But we also have to be focused on the future with the understanding that, everything changes. Next slide. And then, of course, building out the grid and continuing to move forward on some of these cleaner forms of energy is still happening. It's just not in the press the way that it once was. But that is a part of the tools that we'll use to be able to win on the climate crisis and some of these other sets of equity issues that will help us to be healthy. Next slide. I wanted to also bring into our conversation very quickly philanthropic opportunities, because when the government, federal government, is no longer supporting the way that they once were, you've still got some folks out there. Rihanna's still doing some amazing things. You've all heard Mackenzie Scott and the investments that she's been making on the education side, some on the environmental side, on the health side, and some of the others. Some folks are doing what they can to fill the gaps. It's not enough, but luckily there still is some support on the philanthropic side. And 2 years will go by, and hopefully we'll find once again that there's additional resources that building is critical with. Next one. I was also wanted to bring in, some of the other creatives that are out there. And many of you know I used to work at the Hip Hop Caucus a few years ago. So they and others in that space are continuing to move forward on storytelling, continuing to help people to understand the power that exists inside of their vote and their work. And there are the clean creatives also who are utilizing a number of the new technologies to be able to connect with people and get information and success stories. Next slide. I wanted to also talk, as we're talking about solutions, ask everybody to write down the Regenesis project. You can Google it at your leisure, but it's one of those amazing projects. And a part of that was actually building 500 new green homes. The picture or image on the left-hand side is that old shotgun housing. Some of you will know what shotgun housing is, or mill housing. The new houses that are there, significantly more energy efficient, and lower people's electricity bills. Because I know we were having a conversation also sort of on energy justice and energy opportunities. This is one of those living examples about what it can actually look like. Folks who are living in older housing used to pay $300-400 a month for the electricity costs, and new homes are paying $60 to $65 a month for electricity costs. So that's significant for many folks who are living paycheck to paycheck, or just for lots of folks, it's a significant difference. And there are ways to actually be able to zero out people's bills there. Next slide. And then they're putting in a solar farm as well. That'll zero out people's costs. What I didn't put, because I had so many slides, at this particular project, they also have built a number of clinics in the area so that people can access healthcare as well. So they take a very holistic approach to the sets of needs and job creation, healthcare access, housing stock, and a few other things as well. Next slide. And then also nature-based solutions are critically important in us being able to address some of these climate impacts that are going on. So, of course, at NWF, we're very nature focused, and we know that well over a third of the impacts that are happening from the climate crisis can be addressed through nature-based solutions. And the Forging Climate Solutions that you see there on the right-hand side, it's from the American Academy of Arts and Sciences. I'm a commissioner there. And it's a report that we pulled together a couple of years ago that helps to walk people through how we can win on the climate crisis. So you can go to their website. You can get copies of that and have it as a tool. Next slide. And part of nature-based solutions also is there's all these amazing young people across our country, actually across the planet. I work with them everywhere, who are bringing their own innovation and ingenuity into this space. And the Billion Oyster Project is up in the New York area, where they're actually helping to clean the water and helping to address with some of the challenges that come forward because of both pollution and the warming waters that are there. So that's another great project that has shown lots and lots of promise. Next slide. Then there's the Clean Economy Coalition of Color, something I started a few years ago to bring forward all these amazing folks of color who are, addressing the crisis, who are creating opportunity, who are starting their own businesses, and making sure that they have the opportunity to talk with each other, but also just to bring forward what positive change actually looks like. Next slide. And I could not leave you all without talking about Detroit as another set of solutions. Donnell Wilkins is an amazing leader. She used to do Detroit, was working for environmental justice. She also has the Green Door Initiative. So if we're going to talk about housing stock, if we're going to talk about addressing the climate crisis, the young folks who go through this program, there's two sets of people. There are younger folks, and then there are returning citizens who get trained on how to deal with cleanups around hazmat issues, around helping around energy efficiency for housing, and a few other areas. So again, it is about everyday people being able to make significant change on some of the challenges that happen inside of our communities. Next slide. And then we, the people, solutions are get engaged in the civic process. People always ask me, well, what do I need to do? Well, there are a number of things that we can do. And one of them is get engaged in the civic process. In all these years, I've never told anybody who to vote for, but I do say vote for somebody who cares about your community, who cares about the future for your kids, and who's willing to actually do it in an authentic way. So that's one of the things that we can do. And it's my grandmother says you have power unless you give it away. When we don't vote, we give our power. Next slide. And of course, Dr. King, he said one time, he said, we come to these shores in different ships, but we're all in the same boat now. When I think about homelessness, when I think about housing insecurity, when I think about food injustice, when I think about health equity, when I think about the climate and a number of other issues. I mean, it is impacting all of us, some of us directly, others indirectly, but it plays a role. So we have to realize that we have more in common than we have differences. And it gives us then a starting point to be able to do what's necessary to make sure that no one is ever left behind. So with that being said, I think we are going to transition to questions and answers.
Thank you so much for this enlightening discussion. It was really a fantastic lecture and presentation today. We have time maybe for two questions. You can raise your hand or place your question in the chat and I will read it for you. Okay, Dr. Callens.
Hi. I actually don't have a question. I just really have a comment. I really just wanted to just let you know how much I appreciate your talk. Your background, though, is fabulous. All the books, love it. So the comment that you made about, not just, people's address, I think is really key. And as an OBGYN, I've taken that a step further and I've started asking people, where did you grow up? Because if someone lived, for example, in Flint, Michigan when they were younger, there's some exposures that would impact their fertility and reproduction now. And so I think current address and prior address, people may live in military families, they're moving around. And so I hadn't thought about, your place of residence over your lifetime and how that changes and how that impacts things. So I really love that you highlighted that in the presentation today. So thank you.
Thank you. Let me just give a quick shout out also to Dr. Robert Bullard, one of my mentors when I was, coming up as a student and then early in my career. He used to always make sure that we understand that your zip code can determine your sets of exposures, but also how long you may or may not live. So I just want to honor him and bring that forward.
We had some questions submitted ahead of time, and I do want to ask one of them. It's how do we ensure that green energy transitions and housing investments don't inadvertently displace or further burden the communities most affected?
That was an excellent question. So one, there are these things called equitable development principles. A good friend of mine, Carlton Ely, he's one of the folks who helped to pull those together. So when we're talking about housing, when we're talking about land use planning, make sure that we're focusing on those principles. Of course, the environmental justice principles, there's 17 of those, can help to be a guide. But most importantly is to make sure that community is a part of the planning, and a part of the decision making. And that, we should not ever have anything coming into our communities that we haven't asked for or that doesn't bring value to our communities. So that means that we have to organize. That means that we have to also be educated. And when I say be educated, you don't need to have a PhD or an MD or a master's or a bachelor's, because there's all this amazing knowledge that exists inside of communities. Mrs. Johnson has that knowledge. Mrs. Ramirez has that knowledge. So we want to make sure that we're also honoring community knowledge and indigenous knowledge, and then making sure that all of that plays into the strategic planning about what we want and what we don't want. If I could just very, very quickly, going back to the Genesis example in Spartanburg, South Carolina, they developed 144 partners over time. And they had a plan, not just for what they did not want in their community, because there were some polluting facilities that were there were impacts, some cancer clusters, a lot of folks with liver and kidney disease and so forth and so on. But they also knew what they did want in their community. So, we have to be a partner and a supporter in communities identifying what they need. One of the things they knew that they needed was they needed more access to healthcare. In that community at one time, seniors had to travel sometimes 20, 30 minutes to be able to get to healthcare. So they knew that that was one of the things that they wanted. And, they said, well, if we are able to create these healthcare clinics, we can also make sure that folks are getting employed and make sure that they get trained. So, there are ways for communities to be able to get win-wins. But it all starts with, what do we want in our community? What do we want our community to look like?
Well, I know this discussion could go on much longer, but we do need to wrap up today's session. We'd like to thank you, Dr. Santiago Ali, for your time and for participating in this webinar series. And thank you to our participants as well. I hope that you found it useful. As a reminder, these webinars are held on the second Friday of the month. Our next will be August 14th at the same time, and will be on transportation and its impact on communities. Before you leave, we ask you to take a moment to complete the webinar survey if you haven't already. The link is in the chat. And this now concludes our session. Have a wonderful day and weekend. Thank you for joining us.